Welcome, everyone, to the New York State Office of Mental Health Capacity Monitoring Survey, State Psychiatric Center Motors Programs Technical Training. My name is Barbara Brown, and I'm with the Office of Population Health and Evaluation. This training is intended for state PC staff who are responsible for submitting data each month for Question 1, Referral Availability in the MHPD system. So for today's training agenda, we'll start with an overview of the Capacity Monitoring Survey. Then we'll walk through the MHPD application overview, where the survey is located. This part will cover how to obtain access and how to enter the application. Next, we'll walk through how to access the Capacity Monitoring Survey in MHPD. And then we'll cover how to manually enter data for Question 1, the referral availability in the Capacity Survey. We'll get into the reporting details in just a moment, and we'll close with getting help. I do not anticipate this training session taking the full hour. Before we get into the system walkthrough, I want to start with a brief overview of the Capacity Monitoring Survey. Now, many of you may already be familiar with it if you attended one of the information sessions OMH conducted in May, but this overview helps set the training for everything we'll cover today. The purpose of the Capacity Monitoring Survey provides New York State Office of Mental Health with essential information to monitor service access and changes in provider capacity. Now, let's talk about state PC reporting requirements. All 2,100 mental health outpatient treatment and rehabilitative services, motors, sites are required to report each month. This includes every main site and all satellite locations across the state. Reporting is done at the site level, which means each physical site location submits its own monthly data. You'll see all sites that are expected to report listed in the Capacity Survey drop-down menu within the MHPD system. Now, state PCs submit data for one question of the Capacity Survey, Question 1, Referral Availability. And just to explain why we only ask state PCs to submit data for this one question, OMH is able to pull the information needed for the other 6 questions directly from your systems from MARS. At this time, referral availability data is not collected through any other source, which is why we need state PCs to submit it each month. So we need your help to provide this information. The Capacity Monitoring Survey follows a monthly reporting schedule. Each month's data is due by the 15th of the following month. For example, August data must be submitted by September 15th, and September data would be submitted by October 15th, and so on. So after this first submission, reporting continues on that recurring monthly cycle. Each month's deadline is the 15th of the next month, or the next business day if the 15th falls on a weekend or a state holiday. So where is the survey located? The Capacity Survey is completed through the Mental Health Provider Data Exchange, MHPD application. A little bit about the application where the survey is located. Some of you may already be familiar with the MHPD application. For those who aren't, MHPD is a web-based application that serves as the master provider directory for New York State's public mental health system. Its purpose is to allow local mental health authorities and providers to submit, verify, and request changes to program information as required by OMH. This is the same application you would use to add a new site or close an existing one. So if you do not see your site listed in the Capacity Survey dropdown, this is the application you would go to make any changes. Excuse me. Now, there are also a couple of other surveys conducted in MHPD that some of you may already be familiar with. The Total Unique Identifier Survey is conducted quarterly. The Facility Survey is completed each PCS survey year. And now with the addition of the Capacity Monitoring Survey, monthly reporting will also take place in this application. The survey will be available sometime in August, and remember that you have until September 15th to submit your August data. So please, if you enter the application and do not see the capacity survey monitoring survey available in MHPD, it will be at a later date. So user access to MHPD is granted by your facility security manager through the Authorization Management System, AMS. Before you can complete the capacity survey, you'll need to make sure you have the correct permissions. So let's take a look at how to obtain access to MHPD. To access MHPD, users first need an active OMH user ID and token or password issued by their security manager and the Authorization Management System, AMS. They also need to be assigned to one of the two MHPD security roles, either the provider admin or the provider user role. Now note, either role gives you the level of access required to complete the capacity monitoring survey, but the provider admin role has broader security rights, such as the ability to open and close programs. So your facility should decide which role is appropriate for each user. Below are notes included to clarify how access is granted depending on the user situation. Now, users with an OMH who already have an OMH account may still need MHPD permission added. That update is handled by the facility's security manager through AMS. Users that do not have a OMH account will need their security manager to create an AMS account, issue login credentials, and then assign MHPD access. Now, on the next slide, we'll take a brief look at the security manager's role. Each facility has a designated security manager, and they're responsible for entering user information into AMS. They are also the only person who can grant access to MHPD, so any changes to permissions, whether it's adding MHPD access or creating a new AMS user account, must go through them. If you are unsure who your security manager is, you can check with your facility director. And if you still can't identify the right contact, you can email the MHPD help desk for assistance. And here is the email here, mhpd@omh.ny.gov. Okay, now that we've covered what users need for MHPD access, let's walk through how users log into MHPD. But before we do, there are a couple of system requirements to be aware of. Users need to run Microsoft Edge in Internet Explorer, i.e. compatibility mode. This is the only supported browser configuration for this application, and pop-ups must be enabled for the site. Now, this slide deck, which will be sent to attendees, includes step-by-step instructions for both settings. But for the sake of time today, we'll move right into the login process. To begin, users open Microsoft Edge in IE compatibility mode. Once your browser's open, type or copy and paste the MHPD link into the address bar. After entering the link, press enter, which takes you directly to the MHPD homepage. Now on the MHPD homepage, you'll see this link section under resources. I'm displaying just a portion of the homepage needed for today's training. To start the application, click on MHPD Restricted User ID and Password Required. Selecting this link launches the MHPD application and brings you to the Statement Confidentiality screen, which looks like this. Please read the Statement of Access and Confidentiality carefully and then click Agree to continue. Now, once you click Agree, you will see the login screen where you can enter your OMH user ID and token. Enter your credentials. Be sure to select the correct authentication method. Then enter your user ID and 8-digit RSA token code and click Login. If you experience any issues with your token, or log into MHPD, please contact the MHPD Help Desk. Now, once your credentials are validated, the Salute login screen appears. From here, click MHPD to open the Verify Contact Information screen. On the Verify Contact Information screen, review the displayed information carefully. It contains all your current contact information. This screen appears each time you log into MHPD. It's an internal check to make sure your contact information hasn't changed. Users should take a moment to confirm that everything listed is still accurate before moving into the application. If your contact information is correct, click Yes in that gold menu box to proceed. If your details are incorrect, click No and contact your security manager to update them. Okay, now that we're fully logged into MHPD and have confirmed our contact information, we can move into the next part of the training, accessing the capacity monitoring survey. Now, this section will show you exactly where the survey is located inside MHPD and how to navigate to it from the MHPD main menu. So after you click Verify Contact Information, the MHPD dashboard will appear. At the top, you'll see a gold menu bar. From that menu, find and click on Surveys to open the survey screen. On the Surveys page, you'll see a list of available surveys, including the Capacity Monitoring Survey, and possibly others if your facility takes part in them. To open the Capacity Monitoring Survey, click the pencil icon in the row on the right-hand side of the screen. Clicking on the pencil icon displays the screen with your facility name. To open the Capacity Monitoring Survey, again, you're going to click the pencil icon to the right of the screen. This will launch the survey for your facility. Now, before entering the survey, you'll first see this screen that displays primary and secondary survey contacts for your facility. These fields will be pre-populated with contacts provided by your facility from the OMH contact survey. The survey criteria section below the contacts, which defaults to the current reporting year and month, and a return button, which takes you back to the facility name screen. Let's walk through the contacts and criteria sections. So in the contact information section, you'll see the primary and secondary survey contacts for your facility. Below the screen, I provided a brief description of what each role is responsible for. The primary contact serves as main point of contact during each monthly reporting period. They're responsible for ensuring the accurate and timely completion of each site survey, and they are the first person to be contacted by OMH if OMH has any questions or issues related to the site data. And of course, the secondary contact assumes the role and responsibility of the primary contact when the primary contact is unreachable. As mentioned, these contacts were collected earlier from your facilities by OMH, and they will automatically populate each time you log into MHPD. If any of the contact information has changed, you can use the Update Contacts button here to make any updates and make sure you have the correct individuals listed for your facility. Now, below the contact section is the survey criteria area. This section includes the survey year and the survey month dropdown, both of which default to the current reporting month. So when you enter the survey, the year will be 2026 and the survey month, August. You'll also see the Get Sites button in this section. The Get Sites button is used to continue into the survey and display the list of your sites. So let's click on that. So clicking on this Get Sites button, the survey site drop-down menu will appear. This drop-down should display all motor sites expected to report at your facility. If a site is missing or has closed, please be sure to make that update in this MHPD application. Please contact the MHPD Help Desk for additional assistance. From the drop-down, select the site you want to submit data for, and then click on Get Survey button to open the survey. Now note, you also see the Change Month Year button. Clicking this will return you to the survey criteria screen where you can adjust the reporting month and year if needed. Now, before we enter the survey, I want to talk a little bit about survey status. When you start a survey, the survey status will always display as pending. All surveys default to pending when first opened, which means no data has been entered yet and the survey is ready for initial data entry. If you begin entering information and decide to return later, you can click Save. Once you save, the status changes from pending to saved, indicating that data has been entered but not submitted to OMH. And then the final status is submitted. This appears after all required data has been entered and officially submitted to OMH for that site. You'll see the survey status next to the site name in the drop-down menu. It's important to note that once a survey is submitted, no further editing is allowed. If you need to correct something or submitted the survey by mistake after the 15th of the due date, the 15th, please contact the MHPD Help Desk for assistance. Okay, so when you select the site you want to submit data for from that survey site drop-down, then click on the Get Survey button. This will open the capacity survey for that site. So once you selected your site and click the Get Survey button, the capacity survey opens for that site. Now, because the full survey page is too large to display clearly on a single slide, I'm going to walk through it in two parts. The top section, which has survey information, and the bottom section, the survey form. And we'll start at the top half of the survey. So this top section is the survey information area. Here you will see the survey due date, your facility name, and the survey criteria carried over from the previous screen. You also see the survey status, which shows whether the survey is pending, saved, or submitted. The last updated by field displays the name of the user who most recently entered information for the site. And on the right side of the screen is the action menu and the floating gold menu box. Save stores your data so you can return later. Save and submit sends the completed survey to OMH and cannot be edited afterward. This is the final submission. Return brings you back to the facility name screen. Now, one important reminder, if you enter data and click return without clicking save first, your data will be lost. So please be sure to click save as you enter. And once a survey is submitted, no further changes can be made and any needed edits must go through MHPD request. Now, below this information section, you'll see the survey form. For state PCs, you only see that one question. This slide shows the bottom portion, that one question, which is a simple drop down for referral availability. You'll notice several NA options in the drop down menu. These are specifically for sites that do not conduct intake assessments, sites that are school satellites, and New York City programs reporting through NYCMH Connect. If your site falls into one of these categories, select that NA option that corresponds. For all other sites, choose the option that reflects your best estimate of whether you will have availability for referrals. Now, please note the definition for this question. It refers to the calendar days to the first open appointment to schedule a routine intake based on the date you are reporting. Also, keep in mind that data sources you may use for this question, such as scheduling systems or intake logs, to ensure your response is accurate. Okay, once you've entered your selection for question 1, take a moment to review your data and make sure the field is not left blank. When you're ready to submit, just click that Save and Submit up on the right-hand side of the screen. This does not immediately finalize the survey. Instead, a confirmation pop-up appears. The pop-up reads, you have chosen to submit the capacity monitoring survey. Okay, click OK to submit the survey to OMH. Click Cancel to return to the survey if you need to make changes. Once you click OK, the submission is final. After a survey is submitted, no further edits can be made. If a correction is needed, you'll need to contact the MHPD Help Desk to have the survey reopened. Now note, clicking Return in the gold menu box without saving. Again, your entry deletes your data. Please be sure to save your entry before clicking Return. Now, at this point, you're finished entering data for this site. If you have additional sites to report data for, you'll need to return to the survey criteria screen, select the next site from the drop-down, enter the data for that site, and then click Save and Submit to submit to OMH. Do not leave the field blank. If you try to submit without selecting a value from the drop-down, the system will stop you. Instead of the confirmation pop-up, you'll see this field, required field, a blank field pops up, blocks the submission, and prompts you to enter a value before you can continue. Please note that this screenshot says total value. It will say please select a option from the drop-down. Okay, the survey cannot be submitted until a selection is made. Now, once your survey is submitted, you'll see that the survey status has changed from pending to submitted for that site. You can view this in the Survey Criteria Site drop-down menu. You also will see a gold menu box in the upper right-hand corner of the page where you can click on Begin Another Survey. You'll return to the Survey Criteria screen where you can select a different site by clicking on Get Sites to enter additional data. Note that the year and month should default to the current reporting period. Or you can click on that Return, which will bring you back to the facility screen. From here, you can log out of the application by selecting Log Out in the upper right-hand corner. At this point, your submission is complete and the survey for that site is fully entered and submitted to OMH, and you have logged out of the application. Okay, a little bit about follow-up or incomplete submissions. If a site shows a status of pending or saved, it means the required data has not been fully completed or submitted to OMH. In these cases, the designated primary contact for that site will be contacted to complete the missing information and submit the survey. By the 15th of the month, OMH will review all facilities with sites that have these statuses and reach out to the primary designee to request the missing data. All sites must have a status of submitted by the 15th of the month to not be considered delinquent. Site surveys not submitted by the deadline will require MHPD Help Desk assistance to be reopened. Okay, if at any time you need assistance accessing the MHPD application, completing the capacity survey in MHPD, or navigating any of its features, support is available. Please email the MHPD Help Desk at mhpd@omh.ny.gov. When you reach out, we ask that you include capacity survey in the subject line to ensure a timely response. That's it for today's training. I thank you for attending, and I wish you a great day. Thank you.